Hi there, my name's Kyle Morrison. I'm a student with Valdosta State University's F&P program. This is my wife Carly. We're going to be doing a full head-to-toe assessment as well as a H&P intake at a clinic. Carly, do you give consent to be part of this video?
I give consent.
Okay, then let's begin. So, chief complaint, why is the patient here? Why are you here?
For an annual physical.
Okay, patient's here for an annual physical. Next, what isn't relevant is the history of the present illness, which I use old cart, onset, location, duration, characteristic aggravating factors, relieving factors, and treatments the patient has had. Not applicable in this case, so we'll move on. Now we'll do a previous medical history. First, we'll start off with childhood illnesses. Any childhood illnesses we need to know about?
No.
Okay. Are you current on all of your immunizations?
Yes, except the flu vaccine.
Okay. Would you like the flu vaccine?
Sure.
Okay, very good. Next, we're going to move on to adult illnesses. Any adult illnesses we should know about?
Preeclampsia.
Okay, preeclampsia. Any other kind of high blood pressure issues?
No.
Okay, good. What medications do you take?
Prenatals.
Prenatals? Anything else?
No.
Over the counter?
No.
Okay. Any allergies?
No.
None to drugs or environmental?
No.
Okay, very good. Now we'll move on to social history. What's your occupation first off?
Stay-at-home mom.
Okay, stay-at-home mom. What's your highest level of education?
Master's degree.
Master's degree, good. What would you say your financial situation is like?
Stable.
Stable. Who do you live with?
My husband and our child and our dog.
Okay, good. Very good. Do you use drugs or alcohol?
No.
Have you ever used drugs or alcohol?
No.
Okay. Any travel outside the U.S. in the past 30 days?
No.
Okay. Next, we need to find out about your family history. Starting with your father, any adult illnesses he has had?
High blood pressure and AFib.
Okay. How old is he?
58.
Still living?
Yes.
Okay. What about your paternal grandfather?
He had colon cancer.
Okay.
And
Died at what age?
85, 86.
From colon cancer complications?
Yes.
Okay. And paternal grandmother or mother?
You mean grandmother?
Yes.
She died of complications with stroke.
Okay. What age?
86.
Mm-hmm. Now your maternal side, your mother.
COPD.
COPD. Okay. Still living?
Yes.
What age?
57, 58.
Okay. Maternal grandfather.
He's not living and I don't know anything about him.
Okay. What about your maternal grandmother?
Obese and not living.
Not living. Okay. Don't know what age. Okay. So that covers that. Now we're going to do a review of systems covering from head to toe and should help guide our assessment. So in general, have you had any fatigue, weakness,
No.
heat or cold intolerance?
No.
Okay. No chills, no fever?
No.
Okay. Next, we'll do the head. Any headaches, blurry vision?
No.
No. Any hearing changes?
No.
Any drainage of the nose, eyes, or ears?
No.
Okay. Any bloody noses?
No.
Okay. Any bloody sputum?
No.
Okay. Any problems with your dentition or teeth?
Nope.
Okay. Any double vision?
No.
Okay. No blurry vision? Okay. Any shortness of breath?
No.
No? This is easy. See, any dyspnea or difficulty breathing?
No.
Okay. Any changes in your breathing patterns at all?
Nope.
Okay. What about your stomach? Any changes in bowel movements? What's the normal for you?
Once a day.
Once a day? Okay. Sometimes it's different for other people. What about eating? Have you had a good appetite?
Sure.
Okay. Any recent weight gain or weight loss?
No.
Okay. Let's see. Genitourinary. Any changes in urination patterns, as in frequency? Any burning? No. Any getting up at night? Excessive urination?
No.
Okay. Musculoskeletal. Any changes in the range of motion of any of your joints?
No.
Okay. Any trouble with reaching objects, carrying weighted objects, moving around in general?
No.
Okay. Neurological. Do you have any changes in vision, any headaches, dizziness, any kind of slurred speech that's come and gone, or anything of that nature?
No.
Okay. So that covers the head to toe review of systems. Now we're going to actually begin the physical exam. So starting off with the head, we're going to check the head for any signs of trauma. It appears normocephalic, atraumatic. You can look up. And then we're going to look at the face, and we're going to note symmetry. First of all, nose is midline, and lips are without pallor and cyanosis. Now we're going to look at me. Alright, so raise your eyebrows. Frown. Yeah, there you go. Okay, smile. Frown. Puff out your cheeks. Good. So cranial nerve 5 is intact. Now we're going to move on to your palpating your frontal sinus. Any tenderness noted?
No.
Okay. Ethmoid?
No.
No. Sphenoid?
No.
Okay. Maxillary?
No.
Okay, good. Now let's try your TMJ. So minimal popping and crackling there, suggestive of TMJ syndrome. Now we are going to, let me get my tool here. Here. Alright, so this is sharp.
Okay.
And then this is soft.
Okay.
We're testing cranial nerve 7. Okay, so close your eyes. Tell me which is which.
Sharp.
Good.
Soft. Soft.
Good.
Sharp.
Good.
Soft. Sharp. Soft.
Mm-hmm.
Sharp.
Good. What was so funny about that? Alright. Anyway, so that takes care of the face. Now, I'm also going to, while I'm here, palpate the lymph nodes. Now, we have the preauricular, postauricular, let's see, the the tonsillar, submental. This is clavicular, deep cervical chain, superficial cervical chain. They're non-palpable, so that's good. Now we're going to move on to the nose. So I'm going to get my otoscope here. If you would, look up, turn towards me. I'm going to lift up. Okay, so oral mucosa is nice and pink and moist. No trauma to the septum, it's midline. That's for both nares. Okay, very good. Okay, so externally midline, internally midline, no perforation. And then we're going to assess the ears. Okay, so if you would look forward. Okay, I'm going to know if there's any kind of buildup along the auricle here. I'm going to note if there's any tenderness of the tragus or the pinna, which there is not, correct?
Correct.
Okay. Let's see. Take a look in here. Tympanic membrane is a pearly gray with the cone of light at the 7 o'clock position in relation to the umbo. Ear canal is non-arrhythmic. Tympanic membrane is also a neutral position. Okay, let me see the other side. Okay, same thing. Looking at behind the auricle. No kind of buildup there. Let's see, no tenderness along the pinna or tragus.
No.
Okay. There we go. Tympanic membrane is in neutral position, cone of light at the 5 o'clock position, and ear canal and tympanic membrane do not appear to be arrhythmic. So, that takes care of looking at your ears, palpating your ears. Now we're going to do some hearing tests.
Okay.
So first off, I'm going to do the whisper test. I'm going to whisper 2 words separately in both ears. Occlude one ear, and then let me know what I'm saying.
Puppy.
Good. Other ear.
Flower.
Good. So you passed that test. Now we're going to do the Weber test. I'm going to strike the tuning fork, place it in the middle of your head, and then tell me if the sound lateralizes to one side or the other, or if you hear it the same in both. Okay?
Same both.
Good. So you passed the Weber test. Now we're going to do the Rene. The Rene, I'm going to strike the tuning fork. I'm going to place it on your mastoid process. You're going to let me know when you can no longer hear it. And then I'm going to place it in front of your ear and let me know again when you can no longer hear it.
Okay. No. No.
Okay. Good. So air conduction was twice as long as bone conduction, which is normal. So now we're going to test the other side. Sorry.
No.
Perfect. Okay, again, air conduction was twice as long as bone conduction. So that's a normal finding. Now we're going to move on to the neck. So for the neck, first I'm going to inspect the trachea's midline, Then I'm going to palpate the carotids. They're +2 equal bilaterally. I'm going to feel for the thyroid from a posterior approach. Okay, swallow. Okay, thyroid rises, no palpable nodes. Now I'm going to also listen to your carotid arteries for bruits. Good, no bruise noted. So the last thing with the neck is we're going to do shoulder shrug to test cranial nerve 11. So go ahead and shrug your shoulders. Good. Turn towards my hand. Good. Turn towards my hand. Good. Okay, cranial nerve 11's intact. Now we're going to move on to the anterior chest. The anterior chest, we're going to start with inspection. We're going to note that she's not using any kind of accessory neck muscles for respirations, and the patient doesn't seem to be in distress. Now we will go ahead and palpate for fremitus. So if you would, face me. Okay. Say 99.
99.
Good.
99.
Good.
99.
Good. So equal bilaterally. Expected finding. Now I'm going to percuss. So for percussion, I'm just going to go around, listen for resonance. Good. You're in a flat tone. That's indicative of bone. There we go. Resonance. So we have that. Now we're going to auscultate the lung sounds and heart sounds. So you take a deep breath in each time I place this on your chest. Okay. Now for the heart sounds, we're going to start with the aortic, second intercostal space, left or right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And mitral, it's going to be fifth midclavicular. Very good. Okay, takes care of that. Now let's do the posterior. Okay. See now, I'm going to do respiratory excursion or expansion. Take a deep breath out. Good. Now take a deep breath in. Good. Symmetrical expansion of my hands. And then we're going to do the same process. So first we're going to palpate firmitus. Go ahead and say 99.
99.
Good.
99.
Good.
99.
Good.
99.
Good. Okay. Maybe. There we go. All right, now we're going to percuss. On the scapula here and in between the intercostal spaces. Good. Now let me take a listen to you first. Take deep breaths. You're fine. Good. Okay. So while you're still sitting here, before we lay back and do the abdomen, I have a couple more tests to do, okay? So first, for your sense of smell, okay? Cranial nerve 1. Can you close your eyes and tell me what this scent is?
Orange something.
Very good. It is orange. Now, for the mouth, if you would, open wide. Stick it out. Yeah. Say ah. You got it. Uvula rises midline. Let's see. Let me check your tonsils while we're back there. You know what's coming. Go ahead. Good. All right. Tonsils are +1 hidden within the tonsils.
You want to know what it tastes like?
Yes. What does it taste like?
Great.
Great. So cranial nerve 1 is completely intact. Now I'm going to take my otoscope and directly observe corneal light reflex. Look at me. Alright, pupils are 3, round, equal, reactive to light, with consensual light response. Now if you'll keep staring straight ahead, I'm going to take a look inside. Okay. Optic disc is well marginated, no signs of AV nicking or neovascularization. Sclera is clear, sclera is non-icteric, white, and conjunctiva is clear. So now for the same process for the other side. Optic disc is well marginated, no signs of AV nicking, neovascularization. Sclera is white, non-icteric, and conjunctiva is clear. Now, if you would, follow my fingers. Okay. We're going to test the cardinal fields of gaze, or cranial nerves 3, 4, and 6. Accommodation noted. Now, let's do some peripheral vision. If you would, look at my nose. Tell me when you can no longer see my fingers.
Can no longer see them.
Good,
Can no longer see them.
good,
Can no longer see them.
good. Peripheral vision's intact. Lastly, we have this Rosenbaum chart. What you're going to do is start from the the top number and work your way down until you can no longer read it. We're going to start with both eyes, and then we're going to switch to each eye individually. Are you wearing any corrective lenses?
No.
Okay. Here you go.
Where do I hold?
Right there, 36 centimeters.
95874 2843 638 8745 63925 428365 374258 937826 426739.
Okay, very good. Huh?
I'm not a read.
All right. So 20/20 vision with both, or OU, and then go ahead and cover your left eye. So we're testing your right eye, which is OD. So continue.
95874 2843 638 8745 63925 428365 374258 937826. I can't read the bottom line.
Okay. So that would be a vision of 20/25. So now do the other.
95874 2843 638 8745 63925 428365 374258 937826 426739.
So left eye OS is
Perfect.
20/20 as well. Very good. Okay. Let's get rid of those. Now we're going to lay back at 30 degrees and do an abdominal assessment. Okay, so first we're going to do measurement of the JVD. So go ahead and turn towards your left side. Let's see, best way. So what I'm going to do, turn towards that way. Looking for the point of maximum impulse. Okay, kind of hard to see from that far away. I'm taking a straight line, going to the substernal notch here. I'm measuring where my line meets the ruler. So it's at 3.25 centimeters, which is within the normal range of 3 to 4. Now, if you would, see your abdomen. For the abdomen, we're going to first inspect the contour. She has a flat abdomen. You're welcome. She has a flat abdomen, no visible signs of pulsations. We're also going to auscultate now. So we're going to listen to all 4 quadrants. Vowel sounds are normal active. And while I'm here, I'm going to listen for any bruits within the aorta. There are none. iliac arteries. No bruits noted. And then renal arteries. No bruits noted as well. Okay, good. Now I'm going to percuss. I should hear tympany, okay? That's normal. Percuss all 4 quadrants. Now let's listen for the scratch test. So I'm going right beneath the xiphoid process, and I'm scratching, listening for the span of the liver, the changes of pitch. Span is approximately 7 centimeters. That's within normal range. Now we're going to palpate. We're going to start off with light palpation. No masses noted. Any discomfort?
No.
Okay, no tenderness. Now we're going to do deep palpation. Okay. Liver is palpable. Still no signs of any masses. Good. Takes care of that. Now, if you would, go ahead and sit back on the edge of the bed. So we're going to take a general inspection of the skin. Unfortunately, we did not plan this ahead of time for the legs. We're going to assume that the legs are healthy skin tone, color, pigmentation, warmth noted, and no cyanosis. Much like the upper extremities here, skin is intact. It's warm to the touch. Skin turgor, non-tinting, so warm. And check capillary refill. Less than 3 seconds. Good. Okay. Less than 3 seconds bilaterally. Alright, so now, go ahead and grab my fingers. Now pull them. Pull them towards you. There. Alright, good. So +5 strength. Now for these, put your feet this way. And then push like gas pedals. Good. Alright, back the other way. Good. +5 strength. Now let's check your reflexes. So first, we're going to do the tricep tendon. Just relax your arm. There we go. Now we're going to do the bicep. Loosey-goosey. Here, just relax. Good. Okay, now the other side. So again, we're going to do the tricep tendon. Good. Good. Okay. Bicep tendons intact. Now patellar. If you'll scoot back on the bed a little bit further. Good. Haven't done it yet. Alright. Good. It's nice and brisk. Good, nice and brisk. So now, let me check your pulses. So we're going to check the radial pulse. +2 equal bilaterally. Okay, we're not even going to attempt the popliteal.
Sorry.
Alright, so I'm going to check the posterior tibial. It's +2.
Good.
Yeah, it is good. Equal bilaterally. Then the dorsalis pedis. +2 equal bilaterally. Okay, so now we're going to do some range of motion. Okay, so if you would, look straight ahead. We're going to look up. We're going to look down. Okay, then let's do ear to ear for that lateral flexion. Okay, now we're going to do rotation. Good. Okay, now arms. We're going to raise them above our heads. Good. Behind for extension. Good. Good. All right. And then we're going to bring it along our side. Like jumping jacks. Good. All right. Now we're going to, goodness. Well, yeah, we're going to have to do the legs. But first I want to see knee to chest. Hip, knee flexion. Good. Good. Okay, now stand. Okay, let me see you put your leg forward. Good. And back. Good. Same with the other foot. Good. Good. And then we're going to adduct by, there you go. And then we're going to abduct by doing a cross. And then repeat for the other leg. Good. And that's what I was trying to remember. The arms, put them across you like this for adduction. And then, yep. And then we're going to do cerebellar test. So first we're going to do tandem walking.
Okay.
So walk heel to toe, turn around and come back. Okay, good. Now we're going to do the Romberg test. If you would, close your eyes, put your hands straight out in front of you. Whoa, I'm supposed to support you. All right, in case you have a positive Romberg. So no swaying noted. So negative Romberg. Now we're going to, well, they got it. So now we're going to do a couple more tests, cerebellar test, sensory test. So if you would, close your eyes. We're going to do stereognosis, in which I want you to tell me, hold out your right hand, tell me what this object is.
Calculator.
Very good. And then I need you to tell me with your left hand what this object is.
Your instrument thing.
Tuning fork.
That tuning fork.
Alright. Very good. Now we're going to do proprioception. Okay, so close your eyes, hold out your arms. Okay, tell me, is this up or down?
Up.
Good.
Down.
Good.
Up.
Good.
Down.
Down. Good. Okay, so that concludes a full head-to-toe assessment. Thank you for watching.